So hi, again, this is Clara Anderson-Saint, the Program Director with Gilda's Club, Kansas City. And we are here with David Seymour with the Social Security Disability Administration, here to talk us through how to navigate it. Go ahead, David.
All right. Well, good afternoon, everybody. It's always good to be connected with people, even if it's in a virtual space. Definitely I'd love to be in person and reading people's faces and engaging with you personally, but we're going to do our best to make this as interactive as possible here. So as Clara mentioned, I'll be taking questions towards the end of the presentation. And I've done a pretty good job to incorporate any questions that Clara received in advance into today's presentation. So it should be, we should kind of have a good session here today talking about disability benefits. So as you can see here on this initial slide, we see lots of folks as it relates to Social Security, and really Social Security is meant to be there through many aspects of life. Of course, retirement is usually the first thing that people think about when it comes to Social Security, but today our focus will be on disability benefits with a dash of survivor benefits and a little taste of what our online services can offer to you and your loved ones, okay? So, who am I? Well, I have been working for the Social Security Administration since 2005. I'm currently in our regional office, which is here in Kansas City. And the Regional Public Affairs Office is responsible for activities in the states of Missouri, Iowa, Kansas, and Nebraska. And I'm qualified to speak to you today because when I started with the agency, I started out as a claims specialist. So I was the person who took the very retirement, survivor, disability claims that we're going to chat about today and became quite proficient in processing those claims and helping people understand how to file and what their benefits look like for both themselves and any eligible family members. For a time, I was also operations supervisor. And then I got into the public affairs realm as a public affairs specialist. So at this time, when I started with the agency, I was in South Bend, Indiana. So not sure if any of you out there are familiar with that neck of the Midwest, but I was, as a public affairs specialist, I was responsible for going out and communicating with the community, sharing information about Social Security and helping people understand what we're all about. And then what brought me to Kansas City is I became a technical training instructor in our national training studio located here in Kansas City. So that was a great opportunity to train people across the nation about, especially new employees, about how to take claims and how to do a good job, how to make sure we're really serving the American public. So a little bit about me, but of course, most of us are probably aware that Social Security is an actual insurance program. It is the world's largest social insurance program. And it works because there are taxes that are collected that goes towards what you're eventually able to receive from Social Security. Those taxes are often called FICA, and a portion is contributed by you, and the other portion is contributed by your employer. And so those taxes go towards retirement, survivor, disability benefits. And we'll talk more about that today, of course. About 180 million workers pay Social Security taxes in 2020, and about 94% of all those workers are covered or eligible under Social Security. So, it's no secret that Social Security matters to all of us and in different ways and in different spaces, but it really does matter to a very large sector of the American public. And the amount of people that get benefits from Social Security, well, about 60.9 million individuals get benefits from Social Security. That could be retirement, it could be survivor, or it could be disability benefits. And a small fraction also receive SSI. Some of you may be familiar with SSI. It is our Supplemental Security Income Program, and it is a needs-based disability program. So an individual does not is not required to have worked and paid into Social Security to be eligible for a benefit from SSI. And we're going to talk more about SSI as we get deeper into the subject of disability benefits. And there are a small fraction of folks who receive both. One website that I would encourage all of you to kind of tap into is mymoney.gov. We all need to be concerned about our financial wellness and planning for our future. And mymoney.gov is a website established by the federal government to help the American public be much more informed and educated about various financial options, terms, and resources. So you might find some great information there on that site. So I encourage you to check that out as you have time. So of course, let's delve right into the subject of disability benefits. We don't like to think about filing for disability, but it is an important aspect of the Social Security program. And as of December 2019, Social Security pays an average monthly disability benefit of a little over $1,100. And we know that that's barely enough to keep anyone above the poverty level. That averages, those benefit amounts are based on your earnings and your earnings over your lifetime. So that's how we calculate a person's benefit amount. But, according to the Census Bureau, about 56.7 million people living in the US, so about 19% of the population, live with a disability. It doesn't mean that they're necessarily getting benefits, because we know that it's possible to have a disability and continue to work. But about 38.3 million folks, or about 13% of the population, live with a severe disability. And so those individuals likely receive Social Security and/or SSI payments. So Social Security disability insurance, what is it? The purpose of Social Security disability is to provide an income supplement or pay a benefit to folks who are unable to work because of a significant disability. And again, that emphasis is on a person's inability to work because of a significant disability, whether it be physical, mental, or both. Okay. And so what does that look like? Well, the severity of their condition it's expected that they're going to be unable to work for at least 1 year or more, or result in death. So that's when they're reviewing a person's claim, they're looking for information that supports that criteria. Also, Social Security disability is for folks who have not reached their full retirement age. So your full retirement age is dependent upon your birth date, but for most folks, that's somewhere between age 65 to 67, depending on your birth date. So no one above that age is eligible for a disability benefit. They would just be eligible for a retirement benefit. And if a person is working when they file for disability benefits, they need to be earning less than the substantial gainful activity limit. Now, that's a lot of terms there: substantial gainful activity, or SGA as we call it. But that is an actual dollar amount that we're looking at. So if someone comes to us and they say, I'm suffering from XYZ condition, and we say, okay, and then we say, are you still working? And if they are earning above the substantial gainful activity limit, which right now is $1,260 a month, then we are not allowed to send that claim for a medical determination, because they are earning that much per month. Now, as I get a little deeper into the presentation here, I'll talk a little bit more about how we look at work activity and some things that we consider. But when a person is wanting to file for disability benefits, these are the things that we take into account. Okay. Now, on the other hand, and as I kind of referenced earlier, we do have another program that pays that makes payments based on a disability, and that is supplemental security income. SSI is a completely separate program from Social Security. With Social Security, in order for us to pay a benefit, you first have to have worked and paid into it enough. You have to have enough earnings on your record to be potentially eligible for a benefit. But SSI is, it provides monthly payments for folks who have limited income and few resources. So it could be for folks who are age 65 or older, or for any children or adults who are blind or who have disabilities. So in order to be eligible for SSI, we first have to take an inventory of what income you may be receiving or within your household, and then also what is the combined value of the resources that you have, like bank accounts, multiple cars, if you have multiple residences, things like that. So this chart right here is a great kind of a comparison contrast between the two programs. A lot of times the acronyms can kind of sometimes get people in trouble and create confusion. Sometimes people will use the acronym SSI when they're really meaning to talk about Social Security disability. Usually I find when folks use the acronym SSDI, as you see at the top of the screen, then that means, okay, yep, they already know what they're talking about, usually, okay? But this chart just kind of helps identify some of the things I mentioned already. You know, Social Security is based on how much you work and pay in. SSI is based on, it's a very much needs-based to determine eligibility. There are no Social Security disability benefits for children. So if a child is disabled, SSI would be the only program that they may be eligible for. And again, that's dependent upon any income and resources. So now we'll take a little bit here to delve a little deeper into how disability is defined when it comes to Social Security. So I kind of stated this earlier, but what we're looking at is if a person is unable to work due to a severe medical condition that either has lasted or is expected to last at least 1 year or more, or result in death. Okay, so when we say result in death, if they've been diagnosed with a terminal illness, you know, a terminal condition, or they receive some kind of terminal diagnosis. And then also, when we're looking at the work standpoint, the condition has to be so severe to keep them from doing substantial gainful employment. Again, that's that dollar amount that I mentioned of $1,260 a month. And the evidence must also show that it would keep the individual from doing work that they did in the past and keep them from adjusting to new work. Okay, so sometimes when people file for disability, they think, oh, well, I can't do my job anymore, so I should get disability. And that's not necessarily, it's not that simple in a sense of how we look at a person's work activity. Now, you'll see at the link on the bottom of this page is that this is a link to the Blue Book. And you don't necessarily need to go out and consume all the information in this Blue Book, but we share it in the slides because we want people to understand, one, what some of the criteria that Social Security looks at to determine if a person qualifies for Social Security disability benefits. And then it also provides some more specific information about conditions and information of that nature. So you could find some good information there, and perhaps working with your doctors or your medical professionals, if you're filing for Social Security disability, making them aware of this resource might help as you discuss with them, your care and your prognosis. One of the ways that we as an agency do our best to try to make sure that we get to making a decision as quickly and efficiently and accurately as possible is by automatically screening all applications that come in for the possibility of a compassionate allowance. Now, what does that mean? Because that sounds like a very flowery term, right? But it's a way of quickly identifying diseases and other medical conditions that are pretty straightforward. You know, like if someone has been diagnosed with ALS, you know, if someone has been diagnosed with XYZ condition, there's a wide variety of conditions that are listed on our website under compassionate allowances. So what it does is it allows us to target those individuals and get the precise medical information that we need quickly so that we can go ahead and make a determination on that claim as quickly as possible. So what does quickly look like? Well, quickly I've seen, and I remember when I was taking claims, not too many years ago, but enough now, there would be claims that, you know, I would take a claim from someone on Monday, and if our medical examiners were able to get the medical information from the medical provider, you know, whether it be the hospital or their doctor, within a day or two, there was often a decision made on that claim by the end of the week, if not sooner. So it's just a way for us to kind of fast track claims that come through our systems. Of course, we also partner very well with the Veterans Administration in terms of sharing medical information and also eligibility information. So when an individual does tell us that, you know, the Veterans Administration has records or that they are a veteran, we definitely contact the VA to get that information so that we can expedite medical decisions. One of the biggest questions that we get is, when should you apply for disability benefits? Well, apply as soon as you become disabled. And when we say become disabled, you know, obviously that definition is tied to work. Okay, so if you're unable to work at all, or your earnings are below that substantial gainful activity amount of $1,260 a month, then that would be the time that you would want to consider applying for disability. Most applications take 3 to 5 months. Again, it could be sooner depending upon the circumstances. And also too, you know, when it comes to processing the application, we're going to talk a little bit more about that process here. Okay, so before I get there, what we do in our offices in Social Security is we gather all of the information. First of all, we make sure that you've paid into Social Security and, you know, you have enough earnings and that you're actually insured for disability benefits. And then we also ask you for information related to your medical conditions and some work history information. So, you know, you tell us about your doctors, your medicines you're taking, any hospitals or specialists you visited. You tell us about, you know, any kind of limitations with your daily activities. And then also too, we ask you about the nature of your work history. You know, if you're a person that's pretty much been in one career all of your life, or if you've had multiple careers or, you know, things like that, we're asking just some very basic information about your work history. So we know, you know, we kind of have an idea about what your ability to adapt to other work may be like, you know, or doing past work. So once we, and I say we, I mean our claim specialists in our Social Security offices, once we get that information from you, whether you file online or whether you do an application over the phone with us, we send that down to our disability determination service. Each state has a disability determination service, and we contract with them to do all of the medical aspects of disability applications. So there is a team of medical examiners, of doctors, and other licensed professionals who go about the business of getting your medical records from the places you tell us about, reviewing that information. Sometimes we may ask you for additional information that isn't necessarily revealed in your medical records. We may ask you to go to a consultative exam if we need additional information. So that's kind of part of that when they're making the medical determination. That's kind of what's going on there. And then they're reviewing all that information to try to say, okay, this person says they're disabled because of X, Y, and Z. Where is the medical criteria for that? What is their ability to adjust to other work? And so on and so on. That's where they're doing all of that evaluation. Okay, so, I did mention that you can file online with us at socialsecurity.gov. Hopefully most of you have created your My Social Security account so that you can have instant access to information about your Social Security benefits. So you can file online once you create your account. But if for some reason you're not able to file online or you're not comfortable with that, you can call us to schedule an appointment. I know the slide says to make an appointment at your local office. Most of you are probably very, very keenly aware of COVID-19 implications right now. And although our offices are closed to the public, meaning we are not receiving visitors in our field offices, you still can contact our offices. We do have limited staff available who are answering phones and still scheduling appointments and assisting the public. So on our website at socialsecurity.gov, there is a contact us button at the bottom of the page. You click on that and it would take you to our office locator so that you could get the actual phone number for your local office. But if you're just calling to schedule an appointment, you can definitely call our national toll-free number there at 1-800-772-1213 to schedule an appointment. So again, I kind of explained some of this before, but because I get excited talking about the actual process of what happens when a person files their application, right? We make sure we meet all the technical requirements, and then we send it down to the disability determination services for your particular state for that medical evaluation. Okay. And again, just kind of a restatement. Like I said, sometimes I get excited and I get ahead of myself, but I just like making sure people know what to expect when they file for disability, because often it's a scary time and people are worried about, their future and how are they going to pay their bills and, take care of their family. So it's good to have a very clear understanding up front of the process. So you're not expecting a decision within 30 days, or, you're not expecting some kind of immediate turnaround time. So when they're actually reviewing your claim, they're really looking at this 5-step process. First, they need to see if the person is working. Then they need to determine, is the medical condition severe, right? So does it, what's the severity of the condition? How serious is it? And also too, what's the prognosis, right? Do your impairments meet or medically equal a listing? So is there already kind of like an identified impairment on the medical criteria that our examiners and doctors review? And then of course, those last 2 questions are related to your ability to work. Can you do past work? And can you adjust to any other kind of work? So it's a pretty detailed, process. It's not just because you've received a diagnosis. It's very much connected to your ability to work. So all of that process goes through, with all that review, we get your medical records, they review everything, and the medical examiners issue a determination, okay? When they do that, you'll receive a letter, and it is very complete in terms of saying what evidence was reviewed, what you allege your conditions to be, all the information that was evaluated, and how the medical examiners arrived at that determination. Okay. And that information is definitely included in the denial letter so that a person can clearly understand why they were denied. Okay. If you're approved, then the letter simply will say, yeah, you know, we'll send you an award notice, and it says the amount of your benefit, when your payments will start, and the things that you need to report to us. So you definitely are given detailed information when a decision is made on your claim. Okay, it's not just kind of, oh, I don't know what's going on. No, we tell you, you know, and if you disagree, you have the opportunity to appeal that decision. And you need to appeal within 60 days of the date on your decision notice. Okay, so there are sometimes people get discouraged if they're denied the first time. And sometimes that can simply be there may not be enough medical evidence yet to clearly show that you meet the definition of disability as it applies to Social Security and SSI. So we definitely encourage people, if they still are disabled, you know, when they receive the denial notice and they're not able to return to work, it is always in your best interest to appeal that decision. Because, you know, if there is additional medical evidence or if circumstances change, you could be approved back to your original application. Okay, so you never lose anything by appealing, so to say. One thing to think about that sometimes is not considered when a person files for disability benefits is that if you're approved, there could be other benefits payable to family members. So first and foremost, a spouse could be eligible for benefits on your record if your spouse is at least age 62, and at any age if caring for a child who is under 16 or disabled. Divorced spouses may also qualify if the two of you were married for a long enough period of time, and as long as they are not married at the time that they file for benefits. And of course, children may also be eligible for benefits on your record. So those children who are not married and under age 18 or under 19 if still in high school, and then children who are not married and who are disabled before the age of 22. So these are all questions that we ask in the course of your application. So any application a person files for Social Security, we're going to ask, have you ever been married? Do you have any marriages that ended in death? And do you have any minor children? And do you have any children that were disabled before the age of 22? And we do that because we want to make sure that if a person is approved for benefits, we want to make sure that we pay anyone else on the record who may also be eligible. I know one of the questions that we received in advance, a couple of questions actually had to do with medical benefits that go along with getting Social Security disability. And so this is really what it's about, okay? There's Medicare and there's Medicaid. There's often a lot of confusion between these two terms, okay? Medicare is a federal health insurance program for people age 65 and older and people who have been getting disability benefits for 24 consecutive months. We're going to delve a little deeper into that in a second, so hold tight, okay? Medicaid, on the other hand, is a state health program for people with low incomes and limited resources. So some people are often like, man, how do I keep those two separated, right? Well, the way I do it, this may work for you. I say Medicaid, it sounds like state, right? The long A, Medicaid, state. For Medicare, has an R in it, federal. I know it's a stretch, not exactly a perfect association there, but that can be a great way to keep these two straight so that you don't inadvertently say one when you mean the other, okay? So when we're looking at your eligibility for Medicare, again, under the umbrella of disability benefits, you have to have been entitled to disability benefits for 24 consecutive months. So that starts from the first month that you were entitled for benefits. Maybe we take your application and we determine that you're due retroactive benefits. You know, you've been disabled for a couple of years, but you just filed like recently. We can go back to pay you benefits. There's a limit to that. But it's starting from that moment, from the first month that you're entitled to benefits, and then 24 consecutive months later. That's a big issue. And we know that as an agency. The federal laws are established, though, in this way to where there is no insurance or no other type of coverage available through Social Security or Medicare sooner than that 24-month period. So in some instances, individuals may be eligible for assistance through their state Medicaid program. You may also be eligible for insurance through, if you're married, you may be eligible for insurance through your spouse's employer. That would definitely be coverage that you would want to continue with so that you have some sort of coverage until Medicare would kick in. So it is definitely, I say all that to say, it is definitely a challenge. It can be a challenge to find coverage while in this process of filing for disability benefits. But these are the options, you know, that are available. There may also be things available to you through the marketplace. But again, Social Security is not really involved with the marketplace in that way. Another question that we received in advance was about if you can work and receive disability benefits. And you can, okay? Because sometimes people see disability benefits as like a death sentence, you know, like that they're never gonna be able to work again, or, you know, there's some challenges in saying I'm applying for disability benefits. It's kind of like you're giving up, and that's definitely not the case. Social Security encourages individuals to work and receive benefits because, well, you know, let's face it, you know, that $1,100 a month average benefit is not enough to cut it. And there's also a lot to be gained from continuing to work in some capacity. So there are some special rules called work incentives that help you test your ability to work and still receive benefits. Okay, and there are some other support services that you could be eligible for as well. Maybe you need, you know, some additional training or some new training to go into a new field, or maybe you need some assistive devices that could help you be more productive and actually, you know, do the job that you've been asked to do. So those are some things that we look at and do our best to assist you with, and also other state agencies can also assist with some of those resources. So if you do take a job or become self-employed, you have to tell us about it right away. That's one of the main reporting responsibilities for folks who receive disability benefits. We have to know the aspects of your work so that we can determine if that's going to impact your benefits in any way, or if, you know, the amount that you're making is minimal enough to where it's not going to impact your benefits. One of the publications that I would encourage you to review, it's called Working While Disabled, How We Can Help. That is one of our most popular publications, and it really goes into very specific detail about the amount of earnings that we count, how we count your earnings, and then also other things that we take into consideration, such as maybe your employer is allowing you to work less or is allowing you to be not as productive as the other employees because they're trying to work with you and your condition. Those are things that we take into account when we're actually determining the value of your earnings for disability purposes. So again, that brochure that I mentioned is called Working While Disabled, How We Can Help. And when you go to our website at socialsecurity.gov, you can just simply type in those words in the search engine, and that publication will come up for you. Another thing to consider when you're filing for benefits is the possibility of a representative payee. So what, effective in March here of this year, what we've allowed folks to do when they file an application is we allow them to tell us at least 3 individuals who could possibly serve as a representative payee if the need arises. So what is a representative payee, you ask? Well, sometimes for a variety of reasons, we become unable to manage our own affairs, and especially as it relates to Social Security, your own benefits, right? So if you have problems communicating, if you have problems understanding the letters we send or your reporting responsibilities, maybe there's some memory issues there where you would want someone else to be to assist in managing your affairs on your behalf. This is a great way for you to tell us in advance of some folks who you think would be able to help you with that. Okay, so it's not a requirement, but it's our way of trying to be proactive on your behalf and to make sure that make sure that we don't have a lot of issues if something should happen to you and things of that nature. Okay. So of course, if you do any of these things, you have an outstanding warrant, convicted of a crime, or violate a condition of parole or probation, you always need to tell us about that. The kind of general rule is if somebody else is taking care of you or about to take care of you, we need to know about that. So keep us in mind with those things. And very briefly here, as we kind of enter the last phase of the presentation, I'm going to talk briefly about survivor benefits. So earlier, I mentioned that whenever we take an application, we're always concerned about other folks who may be eligible for benefits. Of course, we're asking about any children and of course, any spouses. So if you're looking at survivor benefits, you could receive survivor benefits as a spouse as early as age 60 or as early as age 50 if we find you to be disabled. So, if you're filing for disability benefits and you tell us about a marriage that you had and you're a widow, perhaps that marriage ended in death or that spouse is now passed away, you may be eligible for disabled widow benefits. Okay, so that's another reason why we ask those questions for eligibility purposes. I'm not going to get into the details here of benefit amounts, but the earlier you file for a retirement or a survivor benefit, the more your benefit amount is reduced. So, and the same applies for just basic retirement benefits. So if you're at your full retirement age, 100%, if you file at age 60, there's a reduction there. And you could choose to receive a survivor benefit first and then file for your own retirement benefit at a later time, or file for your own disability benefit at a later time.
David, it's Clara. I just want to give you a time window of 12:45.
Got you. Thank you. Yes, I'm aware. Thank you. I appreciate that. Again, benefits are also eligible for children, and in certain cases, parents may be eligible for benefits on your record if they are dependent upon you for more than half of their financial support. And of course, a lump sum death payment is payable to a surviving spouse or child in the event that you pass away. Okay. This chart, just again, kind of like an earlier chart, does a comparison between spouse and survivor benefits. Just kind of gives some basics there about how early you can start and the reductions that apply there. And that switch of switching from one to the other is possible if necessary. And of course, folks are always concerned about the future of Social Security. With COVID-19 and other things going on right now, you probably haven't heard as much about this in the news lately, but there's lots of discussion about the future of Social Security. One of the things to keep in mind is that people are living a lot longer than what they used to, right? So the life expectancy, as you can see on this slide, the ages for men and women have increased substantially. And so that places a strain on the Social Security system. Folks are receiving benefits longer than what was originally expected for Social Security. So that's one aspect that's taken a look at. Also, birth rates are an issue, right? We're not having children as much as we used to. And so that ultimately leads to having less workers who are paying into Social Security. So none of these concepts are new. It's very clear that we are very much in the conversation with Congress about the changes that need to happen to keep Social Security fluent and strong into the future. But as it is right now, if there are no changes made to how Social Security is managed and financed and things of that nature, we estimate that we'll be able to pay all benefits in full and on time until 2035. And again, there have been changes throughout history that have kept Social Security afloat and keeping it very live and vibrant as it is now. So it's not like this is the first time that Congress has made changes. But if there are no changes before 2035, at that point, we estimate that we'll only be able to pay 79% of each benefit due. So what does that mean? That means if you're expecting $1,000 a month, we'll be able to pay $790. That's a whole lot more than zero, because when people hear the word bankrupt in Social Security, they think zero. But $790 is still a lot less than 1,000. So the good news is that there's plenty of time between now and 2035 to change that. It just takes congressional action. And so just a great opportunity to be very much connected to your elected representative to see what their thoughts are on the future of Social Security and to share your opinions and your voice about that. So I'm going to pause here because I want to make sure we have plenty of time for questions. I'm going to probably automatically assume that most folks have been on our website to create their My Social Security account and explore some of the online services that we have. But I'm happy to take any questions at this time about any of the topics we talked about here today or others.